All right, so let's talk about some of the diagnostic pieces now. The actual, let's do a deep dive here. There are a few major ways of just broadly, regardless of the disorders we're talking about, that are important to consider. The first is diagnostic overshadowing. Coined decades ago, not just about autism, it used to really be about intellectual disability, where there might be a mental health issue going on, emotional problem going on, but that's overshadowed by the diagnosis of autism. And that happens in three different ways. The first is that instead of seeing the mental health, the anxiety disorder as anxiety, they say that's just autism. Right? So they don't see it. It's completely overshadowed, let's say. The second is that maybe they see the anxiety and they say, yeah, there's anxiety there, but it's really not that severe. Okay? So they see it, but they don't recognize the impact of it because this child is already impacted by their core impairment. And you can understand where they're coming from, right? Because if a child already struggles with making friends and kind of relating to others, then the anxiety, the additional piece, might not look like it's actually impacting a lot more than that. So they might say, well, it's there, but it's really not that serious. It's not something we just need to focus on the autism. Same overshadowing outcome. And lastly, somebody might say, okay, they're having anxiety, it's serious, but there's nothing we can do about it because they have autism. So we can't use CBT, or there's nothing we can, it's just, they have autism, so they're gonna be anxious. So that's kind of things that they're myths, obviously, but those are things that we have to keep in mind. Another thing that might occur is baseline exaggeration. So this is really where behaviors might always be there, but what's different now is that those behaviors, so a behavioral problem behavior might be there before the onset of a mental health issue. But what we see is an exaggeration of those things that existed. And that's how a mental health issue is represented, I mean. Right? So the person might always have aggression as part of their behavioral repertoire. And it's actually the manifestation of that same aggression that now signals that something else is going on. Okay? So we have to move beyond expecting that it's only a mental health issue if it's something totally qualitatively different from what we already know about Billy. It might be Billy's kind of same issues that are now becoming more extreme, manifesting in a different way. We often see this around obsessive compulsive disorder, where many times people who already show rumination, rumination's not the right word, I'm sorry, rumination is really perseveration on the past and without trying to solve it. What I really mean is people with autism who have a high degree of perseverative focus already, who have that stickiness and that present focus on something they even enjoy, let's say, that same perseveration with additional stressors, often either internal stressors like going through puberty and kind of growing, or external acute or even chronic stressors, can then manifest and take on a new quality to it, a negative quality to it. So the same content, the same things that they were perseverating on and that they like and that they're interested in can actually become distressing for them. It doesn't have to be a totally different thing, or that they never showed obsessions and now they are. Okay, so it's a change of what already exists. Right? And sometimes it's again, you have to keep in mind, if the challenging behavior's always been there and it's always been there in that way, whatever it is, then it might not be, there's a good chance that it's not an additional mental health piece. That is, sometimes challenging behaviors are just that, and they're maintained by the environment, by the antecedents and the consequences. They serve particular functions, and we don't need to move beyond that in our conceptualization. Other times, those challenging behaviors, that might be occurring, but they also might be a manifestation. So careful not to double code, not to see mental health issues all the time when there's challenging behaviors, but also don't let those challenging behaviors overshadow the potential for more. A third kind of piece is issues of cognitive disintegration. This is quite prevalent as an issue, especially when there are questions of psychosis. Or is there psychosis here? Does this teen, do they have schizophrenia now? Is there a psychotic episode here? What's going on? Where a person looks like they lose a lot of the skills that they previously had. Where this might look different, say, from depression, is where in depression one loses interest in activities that were previously pleasurable for them, right? This is more than just losing an interest or motivation. With cognitive disintegration, it really is losing skill sets So they look far more impaired than they previously were, or they are far more impaired than they previously were. So it might happen because of even how they cope with minor stressors. It doesn't have to be a major trauma that then leads to cognitive disintegration. Even smaller stressors that have high levels of emotional experience can, as I said before, take away a lot of those voluntary skill sets that people are working with on a day-to-day. Okay? And they can look very impaired, right? So we often see this, as I mentioned, and it's not just about it's often misinterpreted as psychosis, when in fact it could be related to depression. Often it's related to depression or severe anxiety. Okay, so the person, it's far more common than we think. So Luc Le Cavalier suggests there are three kind of ways that mental health fits, and this is kind of his overall way. So the first is that mental health problems could be a totally co-occurring separate condition. Okay, that you've got, you've got difficulties in autism, and you've got anxiety disorder. You've got a specific phobia. They never had fears before. They were never worried about that thing before even, like bees. And they develop this phobic response to bees, and they avoid, and it's generalized to other environments, et cetera, right? So it's like, so you're saying, yeah, there are situations where that's going to occur. In that situation, great in the sense that then the treatment for that phobia should look very similar to the general treatment for phobia. Right? It's completely, it's like separate kind of conditions. You can also have mental health problems that might be actually a manifestation of ASD, they suggest. So this is that more tricky one where the kind of Woods one, where the symptoms of autism impact the symptoms of the mental health, and that impacts the symptoms of autism, and around we go. Then if you're drawing arrows in that way, then that implies a different kind of treatment, doesn't it? That your treatment needs to factor in both of those pieces. Or another way, if you want to be optimistic, you have many opportunities to intervene, because you can intervene with one or the other, and it should help, right? Because you're breaking that dynamic. The third is that the mental health problems is kind of separate, but not independent from the, but not really independent from the ASD. So this is like his tricky middle ground. So where he suggests that, okay, it's distinct, but the ASD sets the stage for. So the ASD symptoms are not leading to, or there aren't really ASD-related stressors leading to the emotional negative affectivity, right, that piece. But the ASD kind of sets the stage for it because they are impaired, and so they're less able to problem solve. And because of that, they experience this acute stressor, and now they can't cope. So it's not really about addressing the autism per se. It's still, in that sense, addressing the kind of ongoing mental health issue that's now being maintained by its own perpetuating factors, separate from the autism. But the reason why they developed the problem is because of the autism. Did I say that right? Make sense? So you've got these kind of, and why I think this, I use this kind of idea, I ask myself this question when I'm trying to understand mental health issues, because it does sometimes, not all, but sometimes, suggest different treatment options.